Hey, it's Lisa from 45 Urgent Care. I have some new guidelines about coronavirus disease or COVID-19 from the Centers of Disease Control. I wanted to share with you. Some of them are some really important information, and one of them is options that actually may help reduce your quarantine. I know that's something that people are really interested in, and the other one is when to test. And reducing your quarantine and testing is related. So if you come in and you've been exposed to someone who was tested positive for COVID, say yesterday, you're not going to be positive for COVID today. It takes 2 to 14 days for you to develop the infection. The research indicates that if you get tested on day 5 to day 7 and you are negative, you can stop your quarantine because you're probably going to be negative at that point. So if you come into the office and you say, I was exposed 3 days ago, I'm still not going to test you. I'm going to give you a quarantine note. I'm going to have you to go back home and quarantine, come back in 5 days or 5 days from when you were exposed, and then I'm going to do the test. And then we're going to find out if you need to quarantine or not. I hope that helps because I have people who come in and want to be quarantined, want to be tested so they know if they need to quarantine. The answer is yes, you need to quarantine if you've been exposed, but we need to know if you're positive or not at day 5 to day 7. Thanks.